we're going to be going into fetal heart rate decelerations and the 4 types of them. Fetal heart rate monitoring usually consists of these steps, which is gathering the baseline, and then you're going to check the variabilities. And then after getting the variabilities, you're going to check if there's any accelerations. And then you're going to check the decelerations. And you're going to check the frequency of the contractions. And then the durations. So we're going to dive into the decelerations today. So for these decelerations, it's a decreases in the fetus's heart rate. There's the first type, variable decelerations. These ones are abrupt decreases in the fetus's heart rate. And so these are caused by cord compression. So what you're going to do is just move the mother, right? You're going to change the mother's position from left side lying so that the baby can have more oxygen. And then now we're going to do the early decelerations. And these early decelerations, they pretty much, what they look like is that they mirror the contractions. So here's the fetal heart rate on the top box, and the bottom box is the contraction. So that's what it looks like. And these early ones is caused by head compression. And this is usually benign and usually no concern. So what this can also be caused by is like if the mother's about to give delivery or something like that, deceleration, I believe. But it's not called deceleration. It's actually called a descent when it's like head being compressed or stuff like that. So now we are going to go over prolonged decelerations. And these prolonged decelerations is a decrease in up at least 15 beats per minute from baseline lasting greater than 2 minutes, but less than 10 minutes. So that's how it's gonna look like. And it can be caused by various reasons, but the ones like ominous causes, they require emergency action. Some things that can cause them is like the rapid fetal descent and also the cord prolapse. Another thing as well, what you're going to do for this one, the intervention is going to be assess the cause. Sometimes it's like the emergency C-section, so preparing for that. Sometimes for if it's like maternal hypoxia, you're going to give oxygen and position change, right? And then now we are going to do the late decelerations. And these late decelerations, they happen right after the contraction. So here's a contraction and here's the late. With these late ones, they caused by placenta insufficiency, and they're really concerning. What you're going to do for this one is going to be stop Tyson. Yeah, stop Tyson. So change mother's position, administer oxygen, and contact primary care provider. So after explaining these decelerations, it's important to know them and get to be familiar and well aware of them so that when they are noticed and recognized on a monitor strip of the fetal heart, we know what interventions are needed and the reasons why those interventions are used.